All right, our next session is emotional exhaustion becoming a public health crisis. We'll explore the growing mental strain experienced in workplaces, clinics, and communities. This discussion will examine the deeper forces driving burnout, its impact on social society's overall well being, and what health systems and institutions can do to address it before it becomes unmanageable. Please join me in welcoming Carmen Reeves Jenkins, founder and CEO of INR Healing for Abundant Living Incorporated, Michelle Rourke, CEO and founder of Faya Lab, Ann Summer, CEO, founder and PAC of Ann Summer Coaching, Dr. Tawana Houston, founder and CEO of Black Cell Consulting LLC, Melissa Darrington, CCH of Happy Medium Hypnosis LLC, and Dr. Daniel J. Crampton, psychologist and COO of Status Code 4 Incorporated. Let's please give them a round of applause. Welcome, welcome.
Test mic, test mic. Hi, everybody.
Hi, everybody. Okay, there you go.
Hello, everybody. Welcome to day 3 of health and our panel. So today we are going to talk about, is emotional exhaustion becoming a public health crisis? So first, I want to ask everybody something. How many of you know someone who looks successful on the outside, but is quietly exhausted on the inside? Anybody? Ah, there it is. We're like 50%, right? 50% of us know this or are this. So today we're going to spend some time here talking about emotional exhaustion. I'll start with the introductions, and then we're going to have everybody introduce themselves with their name, their specialty. I'm Ann Summer, physician assistant. For the past 30 years, I've been practicing medicine and operating where performance was not optional. So as we unpack this topic, I want everybody to take some time to introduce themselves again with their name, their specialty, and one sentence of how do you think we're misunderstanding emotional exhaustion?
My name is Carmen Reeves Jenkins, and I am a retired clinical social worker. I'm also retired from the United States Army. So I started off in the medical field as a medic in 1978 and progressed from there to respiratory therapy into social work, which I still love. And now I provide life coaching services for women of color, 30 years of age and beyond, military women veterans, and mothers with daughters. What I believe the biggest misconception is that exhaustion is not just in one area. Particularly as we look at the lives of women, we tend to have stages of exhaustion and we tend to go through seasons of exhaustion. And so I believe in looking at things not just holistically, but also looking at things in a comprehensive manner, our spirit, soul, and body.
Hi, I'm Michelle Rourke. I'm the owner of Fia Lab. We specialize in research into the energy and biological essences and creating what we call quantum nutrition. It's a you can think of it as a multivitamin for your much larger energy body, and it's a way of addressing this chronic exhaustion that's happening across all sectors of our society. I think that it has grown far beyond an individual stress problem to a systemic energetic breakdown in the human system that, like I said, can just affect all areas of society and our teachers, our doctors, our politicians, um, decision makers. And when that emotional body gets exhausted, it blocks the pathways to empathy and clear thinking. And these are the people making decisions for us. So it is a real problem that needs to be addressed.
Hi, I'm Dr. Tawana Houston, and I am a naturopathic physician who also operates as a cultural wellness educator. And I examine the historical factors of disease and how it shows up as stress, and the stress creates the outcome of disease. And so when we talk about the whole idea of emotional exhaustion, one of the biggest things that I feel like is missing is just the comprehensive life of people that are exhausted and just looking at it in context and how that ends up creating a physiological response within the body. And so it's not something that's isolated to the mental, emotional of our health, but ends up impacting our whole well being.
Hi there. My name is Melissa Darrington. I am founder of Happy Medium Hypnosis. I have worked in surgical environments for over 25 years, so I absolutely understand and relate to the burnout, the what we ask of our healthcare professionals every single day, mentally, emotionally, and physically. And when we're not giving them the tools, which is what I feel would be most helpful to re regulate in real time, and that's exactly what I'm here and supporting and offering as well is a real time solution to be able to re regulate in real time so that we can get back to ourselves and not only that, but perform at our best. Thank you so much.
And I'm Dr. Daniel Crampton. I'm a psychologist in Colorado, as well as co-founder of Status Code 4 Incorporated, SC4I for short. We work exclusively with first responders and their family members. We don't charge them for any of our services. And one of the things that I would say is a misconception in the mental health field, working with my clients, is when they come into me and they're broken, post-traumatic stress disorder, anxiety disorder, and all that stuff. They feel like they are permanently broken. So we kind of try to change the wordage around. So, for instance, like post-traumatic stress disorder, we change it to post-traumatic stress injury. So that gives them a sense of hope and a belief that they can be healed from this rather than having a lifelong disorder that they're never going to be able to get rid of.
Thank you. This is going to be so interesting because everybody's already added so many different expert areas from this. So, as we go through the questions, I also want to introduce and share a story as we talk about this. This is a professional, then was highly respected, highly capable, and it was a person that everyone trusted when things got very intense. But behind the scenes, this professional, they were doing more than their career role. They were covering gaps and they were carrying pressures that no one saw. So, as we start the questions, we're going to start round one with Carmen Reeds Jenkins. The question is, from your work in emotional healing, what is emotional exhaustion really at its core?
Thanks, Anne. That's a good question. I think that if we have to look at it historically, in the context of women and looking at evolutionary where women have been. So when we look at it cross culturally, internationally, and we look at the challenges that women have had through lifespans, I think that one of the things that we often forget is that there's still this striving to prove yourself. There's still in the world where there's a very poignant opportunity to be seen, but there's still the striving to be heard. There's still a striving to, although we have a lot of education, we have held phenomenal positions as women, but still we're not heard. And the visibility often for women has been one of being an addition to, but also not really recognized for being at the forefront of many things. And so I think that when women get to a place of, I have done everything that I could possibly do, but still I'm not yet valued, I'm still not honored, I'm still not being paid for my worth, then that transcends, as many have already shared, throughout the holistic aspect of who we are as women. And so we really have to get back to owning our core identity and valuing ourselves first and not looking for other people to value us.
Great point. And I just want to add that we're in a generation where our generation is still doing everything. Not only are you having a full-time career, a full-time education, a full-time family, a full-time motherhood, full-time bank account role, you're the accountant, the cleaning lady, all of it at home. We are domestic engineers. And in addition to that, it also overloads the system, right? Ms. Michelle Rourke, you speak about the emotional body and energetic load. How does emotional exhaustion show up energetically before people even recognize burnout?
Great question. I think to answer that question, it comes from first awareness. I mean, emotional exhaustion is not treated like a normal health issue or concern, and it needs to be looked at more like nutrition and sleep and something we're recognizing on a daily basis. To explain it and understand it better, I like to start and tell everybody, we're very electric beings. We have 50 trillion cells in our body, and each cell is 1.4 volts of electricity. That's 70 trillion volts of electricity. We know through science and Maxwell equations that all around every electrical current that's moving is an electromagnetic energy. And that's our energy body. It's our energy in motion. It's our emotions. And it has a specific frequency. And in today's life, we are being bombarded with overstimulation from the digital world, from chronic uncertainty, and not dealing with issues from fear or guilt that can tangle or disrupt or cause dis-ease in that energy body. Now, I come from the hard sciences, and what I am so excited about is over the last 10, 20, even 30 years, we are finally able to write the science and mathematics behind what mystics and yogis and intuitives have always known. That one, we do have this huge energy body, and two, diseases manifest there first before they take form in the physical body. So if you don't deal with those tangles in the energy body, it leads to something in the physical body, and it can lead to anxiety, exhaustion, burnout, separation, depression, and a whole slew of physical ailments. So it is really important to address, but the good news is it can be measured and modified.
I love that. Yeah, it's worth an applause, right? We know that energy cannot be created nor destroyed, as proven by Sir Isaac Newton. And so, if we are bodies and we are energy, just learn to maintain that. Thank you so much. Dr. Tawana Houston, from your perspective in cultural wellness and systemic health, how have historical and social conditions contributed to emotional exhaustion, especially in underserved communities?
Thank you. What we see currently in underserved communities due to the systemic inequities is really people being caught in a cycle of survival. And what I mean by that is, particularly within the Black community, people working multiple jobs to keep ends met, and that, of course, leading to not the adequate amount of rest, as Michelle talked about, living in food deserts where there aren't any grocery stores within 1 to 2 mile radius to access fresh produce. And so just an overconsumption and over reliance on the ultra processed foods that we see in the food swamps, where there's probably statistics say about 2.5 more fast food restaurants per square mile radius in comparison to what you might see in white neighborhoods. And so not only just on the underserved community level do we see the exhaustion coming from these issues, but also when we look at our Black professionals, people that have strived to get to their level of achievement, and it's a process of additional challenges and hurdles and even getting to that point. And so you're exhausted by the time you get to the position, get to the title, and the additional exhaustion comes when there is no representation once you get there. You're it. And to be solo without racial concordance of mentorship, someone to help in terms of you navigating that terrain and other possible invisible barriers to the next level of accomplishment. And so it becomes exhausting when you're not recognized for the same level of accomplishments and achievements as your counterparts might be for lesser achievements. And so all of these things, in addition to not necessarily being your title or your position being respected as an authority figure or a leader or a true voice at the table, and the microaggressions and the code switching that happens in the workplace environment. And so when we interact with all of this, it becomes exhausting to be the only one, exhausting to be in a space where you're not necessarily accepted or appreciated for being there. And that ends up creating the stress, the chronic stress in those environments that leads to disease.
Thank you. I want to continue on with our story of our professional, because what's interesting from what everybody said is they didn't feel weak. They didn't feel irresponsible. They were very responsible. What they did do is they ignored their own nervous system's direction by overriding it with the thoughts that sounded protective, but they weren't. I want to continue on with Melissa Darrington. From a nervous system standpoint, what is actually happening in the body when someone reaches emotional exhaustion? And why can't they just push through anymore?
Right, yeah. So why can't we just keep pushing, right? We're already at the point of exhaustion, we're already overwhelmed. Um, the problem I see is we're calling it a weakness, we're calling it all these other things, and we're not really given the tools, particularly within healthcare, uh, and even patients. I see the overwhelm that they experience, and that has an effect on their own healing process as a result. So when we can have the tools available, even just quick breathing and breathing out for a longer period of time, just for 60 seconds alone can help to de stress and reset the nervous system. The tools that I offer bring that into a space to where 5 minutes can allow you to be able to get back to the resilient state that you need to be in, no matter what you are, what you're doing. You don't have to be a healthcare professional. This is about being able to get back to a state of homeostasis within yourself so that you can do what you need to do and show up how you need to.
Thank you. Thank you. Dr. Daniel Crampton. In high stakes professions like first responders, how does repeated exposure to trauma and stress accelerate emotional exhaustion? And what does that look like in real life?
Yeah, so I want to start by giving a couple stats, so hopefully not to bore you, but on average, research is showing that for a first responder in a 25-year career, they're going to average about 800 traumatic calls over that 25 years, as compared to the average person who may see 3 to 4 traumatic incidents over their entire lifetime. So that's going to be one of the things that's going to just exacerbate and accumulate over that career. Um, some other research from Police One has stated that the life expectancy of a career law enforcement officer is 57 years old. And then if they retire, generally after 5 years, within that 5 years after retirement, they succumb to physical ailments all the way up to suicide. So very short lifespan on that. Um, and then some of the other things like in Colorado, for instance, when we talk about suicides, we've been tracking suicides pretty much since the start of SC4I. We started out with the stats of 2004 to 2014, where there were 196 first responders in Colorado who have taken their lives. From 2015 to 2024, that number has gone up to 597. So when we look at what we're doing in the healthcare industry, we're really trying to get behind that, because right now we're all behind the eight ball, and so that's just accumulating, and it's taking our first responders' lives. The accumulation, the one of the issues that happens with the accumulation of these calls is they could be running on multiple calls in one day. In my 25-year career, the one day that I had the most calls in a 24-hour period was 23 calls that we shared in the department between two ambulances. So in that type of environment, I had a client last week that called me. He'd been out for a while. We do a maintenance program. We never do a termination with our clients because we know that in that particular profession, they're just one call away from having a total breakdown. So he gave me a call and said, I need to come back in and talk to you. I just had a really rough shift. And I got him in and we talked about it, and I asked him what's going on. He says, well, started my shift last week. I went on a pediatric stabbing murder where the ped died. Right after that call, he went on another cardiac arrest, and where obviously they lost the individual. And then right after they got back from that, so this is within like 3 to 4 hours, right after that, they ran on a pediatric drowning death. They never got none of those three back. So he had one call after another within just a couple hours, and he didn't have time to process any of those calls before he was sent back out into the field. And this is happening across the board with most first responders on a daily basis. And in Colorado Springs, some of my clients, they work for AMR, and they do like 12-hour shifts, and they may run 11 to 15 calls per day per shift. And so that's just a lot of calls that they're running on over and over and over. And then we throw in one of the other things that paramedics, especially in Colorado, we have the ability to pronounce a death in the field. So we don't have to call doctors to get permission to cease resuscitative efforts. So we've got that extra responsibility of when we're going to decide to stop working a person or if we're going to continue. So we do that, we go through, we call the person, but then we've got the job if we have to go tell the loved one that their son, their daughter, their husband, their wife, their family member, their loved one is dead. So we have to do that death notification. And I'll tell you what, until you have heard the sound of a mother screaming after you tell her that her son just was killed in a traffic accident, those sounds stick with you. And if you don't have time to process it, you're not going to. And so first responders are notorious for compartmentalizing all the calls and the emotions that they go on. I always tell my clients that, it's through the emotions that we get traumatized. So why do we compartmentalize all these calls? Because we don't want to feel this emotional trauma one right after another, so we shut it down. The problem is when we shut it down, it starts coming out in other ways: heart disease, strokes, type 2 diabetes, you name it, and then other mental health issues.
Yeah, such a great point. Thank you for sharing that. Thank you for doing what you did, for sure. Here's what I want to point out, and you might know this if you're in healthcare, if you're at any high stress level, taking care of people, seeing life death situations, is that the medical providers and the clients and the professionals aren't the ones getting the help. We're not the ones getting the debriefing. So if we define burnout or emotional exhaustion as the mismanaged human capacity, sustained overload, and we talk about the professional story, they had a break one day. It wasn't dramatic and it's not loud, right? It's not the screaming, they're not the ones screaming. It's a quiet moment where something breaks, where they think, I can't do this anymore and continue to be who I am. So we're going to move into round 2. And Ms. Carmen Reeves Jenkins, I want to ask you, what has to be healed internally for someone to truly recover and not just cope?
Yeah, these are really good questions. Yeah, so I have to say first, everyone has their way of moving forward through life. And for me, it's my faith. I am a firm believer of God, Jesus Christ, His Word, and His Spirit. And so, what I know to be true is that healing is from the inside out. And one of the primary areas that we often forget about is the soul of the individual. And that is the essence of who we all are. And so when we're able to tap into the soul of the person and help the soul of the individual heal, then everything else, we have been talking about throughout this week, comes into alignment. So then that brings into alignment the mental, it brings into alignment the emotional, it brings into alignment the physical and the spiritual, because we're a 3-part person. We're a spirit that has a soul that lives in a body. And so we can't take one without the other. We need to look at the complete integration of the individual, but then also help the individual understand who they are. And this is not man or female, it's the humanity of the person. And so when we can do that from whatever perspective we're doing it, from an energy perspective, from a social economic perspective, from a psychological perspective, oftentimes what I have found in all the places that I have visited, traveled, and even in the military been stationed, one of the commonalities throughout the world is oftentimes people don't know who they are.
So true.
And when we know who we are, then we can deal with mostly anything else.
Love it. Okay, love it. Now we're going to have to tighten these answers up so that we can get everything in, okay? So Michelle, how can individuals begin to untangle emotional overload before it becomes burnout or illness?
Another good question. Thank you. First, I think it comes from awareness. Another really great thing that we've been able to show and write the physics behind in science is something that mystics and yogis and intuitives have always known. We have a very unique signature frequency, and it is more unique to us than our fingerprint. And also, Einstein gave us the equation E equals mc squared. So everything is energy. If everything's energy, you have to look at it in terms of constructive and destructive interference patterns. If you can recognize you're being hammered with a lot of destructive frequencies all day long, you can start to understand what you can do to fix that. So if you think of it like this, you don't want to go to work because of the new person in the office that you're just not jiving with. Well, chances are they have a signature frequency that's destructive to your own. And when you go to like 2 o'clock in the afternoon, you're exhausted and you don't know why. And chances are you've been interacting with a lot of destructive frequencies. But you go home and you open the door and there's your dog, your significant other, your children, and you're instantly revived. And that's because they have a signature frequency that's constructive to your own. So in order to untangle these tangles, we need to be interacting with more things that are constructive to our signature frequency. And there's various ways to do that. Yoga, eating right, meditation, and there's also more holistic things like light therapy or sound healing. And at Lab, my favorite, quantum nutrition, where it's literally a multivitamin for the energy body that's in a constructive frequency to your signature frequency.
So interesting. Thank you. Dr. Tawana Houston, what role does community and environment play in true recovery and prevention?
In my book, Black Wellness Barriers, I discuss the collectivism of wellness. Healing cannot be done alone. We live in a society where the dominant culture drives a individualistic way of being in the world. However, the Afrocentric way of being is based around a concept called Ubuntu. I am because we are, and we are because I am. There's a cyclical nature in the relationship, interdependence in the relationship. And so the whole concept of individual healing is the individual is not fully whole and healed until the community is. And as we talk about what that looks like from a cultural perspective, it is basically joining in the forces of community. There was a study that showed just how isolation, social isolation, and chronic stress can lead to just a shortening of the telomeres, which are the end caps on our chromosomes that can put one at a higher risk for chronic disease as they age. And basically, when we are in isolation, that is what is happening. But the same study shows that when we are in nurturing environments, it serves as a protection to the telomeres. And so,
Wonderful.
my recommendation is to be in those communities that are affirming your identity, that are supportive, that are nurturing, the wellness
Wonderful.
circles, the
Wonderful.
religious circles, the
Sure.
communities, so that one can be healed in the context of community and not individualization.
Beautiful, 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 definitely. Melissa Darrington, what is one immediate tool someone can use today under pressure to regulate their system?
Yes, we talked about this a little bit earlier, but it's very simple. It's something you do every single day. You're just modifying it a little bit. Breathing. Literally breathe in, but when you breathe out, exhale for a little bit longer. This will allow your nervous system to naturally reset. It will help you to be able to think better, clearer. You will feel better within your body, and you'll be able to perform at your best, no matter what it is that you need to do. And it is the best way that you can give a little love to yourself, as well as be able to, especially if you work in healthcare, but no matter where you work, you'll be able to be your best for everyone else.
Beautiful. Dr. Daniel Crampton, what needs to change at a systems level so we prevent emotional exhaustion, not just treat it after the fact?
It kind of two parts. Number one is in the administrative role. Administrators have to realize, especially in the first responder world, that we need to give each individual downtime so that they can recuperate at least as much as they can. So, maybe take an hour off or pull them off the line and let other crews come in and take over for a bit. So that's the administrative level and getting buy-in on that. And the other level is the ground floor level, the paramedics, the law enforcement, the firefighters. We all have to get rid of this stigma that the mental health is a weakness and that it means that you're incapable or incompetent. So we need to open ourselves up and normalize anxiety and depression and post-traumatic stress and exhaustion and burnout and stuff like that. And so if we can do that, we can allow everybody to start sharing and expressing the emotions, especially with those that they trust. That's going to go a long way in helping all of us regulate that system, come back down from it, and then be healthier.
Great, great. Okay, we've been talking about our emotional exhaustion in so many different perspectives. Thank you, everybody. And then we were talking about the story. And I want to disclose something to you because that person that burned out was me. And it's not because I was weak, and it's not because I hated my job. It's because I was not only doing my full-time job of a surgical physician assistant working too many hours a week, but then I was a part-time nurse, a part-time triage, and a part-time scheduler. And then administration decided to give a new electronic medical record. Oh, and then my MA retired and they didn't replace her, and then they told me to do her job. This is the reality that we're living in. And it's a lot of work. We have to do a lot of work. It makes me emotional every time, right? Yes. So when we talk about this emotional exhaustion, I want to do one more lightning round. You guys, I don't know if I told you this. You're going to fill in this question, and it's a fill in. Let me find it in my paper. And if people have questions, start thinking about them. Okay. So I want you guys to think about this. It's a fill in. Emotional exhaustion is not blank, it is blank. I'm going to give you a second to think about that. And then I would just want to give one more message. Because when we're in environments like healthcare, and every environment that every one of these people discussed, they're not different, but they're different. The environment and the communication are the problem. We have people carrying out medical business that's not built to listen to one another. Our administrators don't listen to the people that are doing the practice. We have a business that's built to produce, it's built to perform, and it's built to generate in a system that was never designed for human-centered, but patient-centered. We just have a lot of work to do. We don't have a resilience problem. Every single up here person is very resilient. Every single person out there is resilient. We don't have a workforce problem. We have a misdiagnosed problem. Because the people we call burned out or emotionally exhausted, they're not weak. They're the ones who stayed strong later than the system was designed to support. So, Ms. Carmen, emotional exhaustion is not.
Fill in the blank. It's not an inability, it's an expulsion of your complete capacity.
Ooh.
So we all have different capacities. And so when you get to E of your capacity without the opportunity to refill, revive, refresh, then that's exhaustion.
I love it. Michelle.
Emotional exhaustion is not trivial. It is a energetic breakdown of the human system that's affecting society across every sector. It is a medical condition that should be given the same treatment as sleep and nutrition, and it deserves preventative measures.
Beautiful. Tawana.
Emotional exhaustion is not disconnection. It is signaling to the body that something needs to change now.
Good. Melissa.
Emotional stress is not weakness. It is saying, I need a way to calm down. I need a safe place.
Gorgeous. Daniel.
They stole my answers. So
Dig deep, Daniel.
Emotional exhaustion is right. It's not a weakness. It can cause some weaknesses in the body and breakdown, but it is a warning sign that you need to pay attention to what's going on and do something about it now.
Mm-hmm. Yeah, gorgeous. Emotional exhaustion is not a myth. It is a fact. It is a fact. We're born with a heart that beats and we don't think about it. We're born with lungs that breathe and we don't think about it. We are born with a nervous system that tells us what to do and then we think about it. Everybody give applause to our expert panel. Thank you so much for listening. And if there's time for questions, I don't know. Any questions? Blonde, there's a mic coming for you, right behind you, to your left.
When emotional exhaustion comes from the person that is fighting her mind for survival in a community that is not really healthy for her, or her job is in an area where it's like opposing her, but she needs that job. And she recognizes that she has to change some things because she is, really almost critical level, but she needs the job and she can't find another one. How do you suggest that she handles that?
That is definitely where community support comes into play. In your community, you can find empowerment. You may not have all the answers in that moment, but when you know that you are not going to be defeated by your circumstances through the empowerment that you're getting from other people and tapping into the other resources that are around you. So you may not have everything that you need to know, but the people around you can provide you with some guidance and some assistance. So it's not something that may necessarily change overnight, but when you start to feel like you're not going to be succumbed by it, it gives you the strength to continue to put one foot in front of the other every day until you begin to see some other external changes unfolding in your life.
I'm going to add to that also. Most organizations have EAP, Employee Assistance Programs. They're usually not well advertised, but they're there. My hospital had it. It was not well advertised until somebody came and said, Ann, you need to talk to EAP. So she's absolutely right. In your community, there are free services, and you can call probably your Chamber of Commerce and ask. If you haven't talked to your manager and their manager, you do have to go through the right ranks just to express, I am struggling. I need this job, but I'm struggling, and this is why. And you need to have definitive reasons and then present a solution to them. And that would be my advice, sweetheart. Yeah.
Thank you.
You're so welcome.
And additionally, because I've been there, sometimes you have to find someone that is not in a supervisory role, someone that's not in a leadership role, but someone that you can just share your heart with, someone that will just listen to you. Because there are sometimes those hierarchies and differentiation levels of authority. And so when you can find someone that you can just go into their office, close the door, and cry before, and just share the struggle of the day with, and then get yourself back together and go back and do your job, someone that will help you get through the day, sometimes that's helpful.
Thank you.
Hi, thank you for this panel. I'm a firm believer that the last is, sometimes the best. So I think we all feel blessed to be here still, to hear what you have to say. My question is, when you are dealing with a family member, loved one, friend that you see in that type of distress that you mentioned, Doctor, and they have gotten to that point that emotionally, physically, medically, they have started to decline because of all that they have seen and gone through. But they themselves are not wanting the help, but you kind of want to guide them towards seeing that they need help. Where do you start?
As the mic's being passed to him, this was me. That person doesn't see it. This is the biggest problem. I did not see it. I knew I should leave. My gut said, it's time to leave. And my head said, but I can't. I can't leave a 6-figure income. I can't leave health, dental insurance. I can't, this place can't run without me. I can't leave my patients and I can't leave my coworkers. And it's going to get better. And that is the biggest downfall of the whole problem. But I'm so curious to hear what he says.
And I mean, that's partly what I was going to say too, is sometimes we don't see it. The family member might not see it. So having, the interventions, we've all heard of that, but having those trusted individuals in that family, in that person's circle of influence, have them come alongside. Or what I've done, because I also work with peer support teams throughout all the agencies that we work with. And one of the things that I have my peer supporters come up to the individuals and say, hey, I'm noticing something's going on. I don't know if you're aware of this, but can we talk about it? And then we help them get the resources and stuff like that. And then, if they're starting to break down, regardless of whether they want the help or not, because most times when you come up and you ask them, tell them what you're seeing, they start to tear up or they start to break down. For me, I'll sit with them and just let them. I mean, I've had guys where they're in fetal positions on the ground just crying, and I just sit there and I work with them. I don't rescue them. I don't hand them the box of tissue. I don't put the hand on the shoulder or tell them it's going to be all right. I sit there and just let them process it. Let them just vomit out that emotion. Sorry, gross, but sometimes that's what it feels like.
Yeah. Verbal vomiting, I call that. And for you, that family member needs you. Your intuitive sense that they're in trouble is going to be what's going to save them. I'll give you a little example. When I was practicing medicine, one of the physicians, we were in OBGYN. She went to the emergency room. A young girl came in with some tears down below, and she took her to surgery, and she said there was a baby born. And the woman said, no, I had an accident. And there was a baby born, and it was in the trunk. And it was very devastating. And again, she didn't get a help for this. But what happened was she didn't show up to work the next day. And as soon as I heard that, I knew she was in trouble. So I went went to the grocery store and I bought sodas and candies and food. And I went to her house and knocked on the door, and her husband answered. And I said, I know Christy's here. And he's like, she's not okay. I'm like, I know. And I went in and he followed me. I'm like, I got this. And she was in bed. And I crawled in bed with her and I cuddled with her and we ate chips and candy. And that therapy is what is like, that's what they need, is for you to barge through the door with chips and crawl in bed and let them fall into your arms and break, because then they know.
I don't think I need a mic, but and sometimes it's finding one person that they'll listen to. Not someone that's going to be critical, not someone that's going to be judgmental. In the military, we used to call it your buddy system, right? Everybody has a buddy. Someone that they will listen to, someone that they will hear from. And it may not be in the family, but you have been noticing that whenever the person calls or whenever person they ask about how is so and so doing, there's generally one, sometimes there's not, but generally there's one person, and it could be someone older or someone younger than them, but one person that can speak into their life, that they can listen to, that they can call, or that will call them and say, hey, how have you been doing? And then that they will be honest with them. You say you're doing okay, but you sound like you're really not. What's really going on? And then allow that person to just talk.
I want to add to that. One of the things that I've found with my patients, sometimes when people are in those situations, it's because they are exhausted from serving the needs of other people. And that's the same solution that will help to motivate them, because they have learned to put their own needs second, third, fourth on the tier of priorities. When they have reached this point of exhaustion and we see that it is directly impacting their whole health and well-being, it is reminding them of what could happen with those other people that they love and who have they have been taken care of, if something were to happen to them. So almost a reverse psychology of you're burnt out from taking care of them, but if you're not here, then they're not going to get taken care of. And so something ends up clicking like, oh yeah, this is it ends up becoming a motivation, a reason to look differently at their own needs and begin to put those needs first.
I would just add that, like Anne said in the beginning, energy can't be created or destroyed. It has to be transformed. So when you're experiencing all of these difficult situations and just walking around saying you're tough and you've got this and you're fine, really that's just storing that energy in the energy field, and it's going to find a way to express itself and be transformed, one in this lifetime or in another. So crying means you're in alignment with your truth, and it's a way of moving energy. And there's so much power in emotion and moving energy. So allowing people to have the space to do that, but hopefully doing preventative measures that don't get them to that point in the first place.
Remember, we have a nervous system, and our house has a circuit breaker, actually called a breaker. You can overload it. We have a switch too, and that is true in utter burnout, which is what I experienced, but there's different levels. So, Melissa, please add one last thing and close us out.
Yes. Burnout is the biggest thing that I've heard all weekend, or sorry, all week. Um, but the other thing that I've heard is that there is as we've also heard up here, a disconnect in the emotional aspect, the compassionate aspect. And I think what's really going to help, particularly in healthcare, which we're talking about today, but really in any area of, organization, when we are regulated, we are able to perform much better and we are able to think much better. It just makes sense that we need that time each day, whether that's, and what I would like to see is it be available in the workplace as an option for a 5-minute reset, which is what I've developed. And if you get an opportunity, I'd love for you to scan the QR code and try it. Thank you so much.
Thank you, everybody. Thank you, panel.